South Africa's COVID-19 vaccination drive is not just behind the rest of the world, but also much of Africa. That's according to Professor Francois Venter, who adds that the decision to suspend the Johnson & Johnson vaccine rollout over rare blood clots is poorly thought out. Well, he joins us now, and he's with the Wits Reproductive Health and HIV Institute. Good evening, Professor Venter. It's a pleasure to have you with us. So we've seen quite a lot of critique. This is towards government's implementation or lack thereof of the vaccine rollout plan. You've compared it to how we're faring based on other countries, in particular on the continent. Why do you think that we are so far behind than others?
It's difficult because government isn't being transparent with its decision-making. I think it's important for your viewers to understand not a single vaccine has been administered yet in the government program. All the vaccines have been through research programs, and they've all been to a minority of urban healthcare workers. So the people who are really going to get sick and die, the elderly, the diabetics, and everyone, those vaccines have not flowed to anybody in South Africa, while in other countries, even in Zimbabwe, they've been making significant progress in terms of administering the vaccines. Part of the reason is that we have turned away our AstraZeneca vaccines, a decision which many of us were very critical of, and now we have suspended the J&J vaccine, the vaccine that only needs a single shot and doesn't need these difficult to maintain cold chains, and which were a key to the success of the program, particularly in the rural areas. And now we've turned up our nose at that as well in terms of the suspension, again for reasons which just don't make sense to me and many other people.
Now, when we look at the rest of the continent, often the comparison is made in terms of which vaccines the different countries are using and whether or not those are the kind of vaccines that South Africa is considering or is even in the process of approving. At the end of the day, is it going to matter which vaccines have been administered? Because part of the argument that you're making is that we should have kept AstraZeneca anyway, because we don't know what the Pfizer result against our variant of COVID, our dominant variant of COVID-19 will be either.
We have a lot of data to suggest that all the vaccines, we don't have as much data on the 3 Chinese vaccines, but all the other vaccines are out there. We have a lot of data to suggest that even if you do get a breakthrough infection, you're probably going to shrug that off with the levels of immunity that you're attaining, that we don't get what's called sterilizing immunity with those vaccines. So sending away the AstraZeneca vaccine was a terrible mistake to my mind, because we could have vaccinated a whole lot of people on that vaccine landed on the 1st of February. We would have had plenty of time to at least vaccinate people. The absolute worst that would have happened is that we would have given a very safe vaccine unnecessarily. Now we're sitting here heading into the latter end of April with promises of 300 vaccines a week from Pfizer. We need to get to the end of the year and the kind of targets government has set itself, we need to be vaccinating 300,000 people a day. So this, even with the Pfizer vaccine, it's not going to cut it. Government does need to let us know what the plan is and to stop making decisions without experts to actually help them along. And we have lots of those experts in this country. It's just inexplicable that they're not being asked.
Well, one of the things that we saw, of course, were a number of experts in that briefing with the Health Minister, Dr. Zweli Mkhize, some of them also part of the Ministerial Advisory Committee. Off the face of it, the minister also seems to be getting advice from some of the country's top professors as well. These top professors need to account for why they're going against the international consensus opinion from the World Health Organization, plus local people. I'd just like to point out that the Ministerial Advisory Committee, a whole lot of us were on that, and we're highly critical of some of the decisions that were made there, and then were removed. So there is, unfortunately, a tendency amongst government to listen to the people it wants to listen to. And we still have not heard why they have gone against just the AstraZeneca decision that WHO has recommended, and the vaccine that's been rolled across a lot of Africa. That vaccine is cheap. It again doesn't need this extreme cold chain, and was available to the population. Were you given any reasons for why you were removed from the committee?
No, we were simply thanked for our service. And I do think that there is, I think that I'm tremendously proud of my colleagues, even the ones who remained behind on the Ministerial Advisory Committee, for the work that they did, and it was hard work. But I do think that it's a very dangerous territory when government doesn't explain decision-making, when members of the Ministerial Advisory Committee come up with all sorts of reasons that, again, don't explain why we've gone against international consensus. And a large number of us locally who are asking the question, why did you send that vaccine away? Why did you pause the J&J vaccine for what is an incredibly rare side effect, even if it's true? There's a study that came out today. I'm sure everybody's heard about this carotid sinus thrombosis, which is a very scary side effect. But COVID itself, there was a study that came out today, is 100-fold more potent in terms of causing that thrombosis than the vaccine is. And that's just one tiny side effect number. COVID does a whole lot worse than that.
Of course, the situation that we're in is quite complex, Professor Venter, and often we have seen this conflict between different experts who differ on opinions, who differ on what should happen next. Talk to me about, overall, what needs to happen in this moment in order to focus the attention of ordinary South Africans, because the reality is that we can't afford to get caught up in the, he said, she said situation, because ordinary people like myself get confused by the different messaging that is often coming out.
Yes, and I think that I feel really sorry for people because these decisions are hard, and there needs to be some forgiveness in the system for government, for getting these things not always perfect. And I think we've seen that since the start of the rollout. Unfortunately, what we're not getting is the transparencies. Who are they talking to? Why are these decisions made? And somebody to take responsibility for them. I also don't ever see government dialing back on decisions. So, saying we got this wrong, let's recalibrate. And as I said, I think all of us understand we're in unprecedented scientific times. And sometimes it's not just about the scientists. Sometimes you got to think about what else is going on, what's happening with the taxi drivers, what's happening with the economy, what's happening with a whole range of things when you make these complex decisions. I think what I find frustrating as somebody involved in the science side of things is the inexplicable nature of some of the decision making. That just doesn't make sense to me. And the kind of, we'll do what we want to do because we'll do what's appropriate for South Africa, and listening to only a few voices when many of the local voices and the international voices are saying this is wrong. I can see why that would confuse the public and frustrate them.
But, the way that it has been positioned, government has consistently said that it's taking its advice from the Ministerial Advisory Committee, and that is the body, at least, of credible scientists who are guiding or at least giving advice on the decision-making process. So just listening to you and some of the critique that you're expressing during this interview, I mean, does that mean that the Ministerial Advisory Committee is not as credible as we've been led to believe?
Part of my fear is I was on that Ministerial Advisory Committee, and I remember the government and many senior people saying, we're listening to the scientists. We were not making those proposals from the Ministerial Advisory Committee. I remember discussing the cigarette proposals, the alcohol, the filling the taxis. There were a whole range of things. As I said, there was really good work done there by many people, particularly on the issue of masks and sanitizing and the rest of it. But we did not make those recommendations. Yet government ministers would stand up and say, we're listening to the scientists. We would say, who are these scientists? My fear now is that there are controversial decisions coming out. And it's possible that they have access to information that we don't. But they need to explain this. We're not in a war with a foreign power where everything needs to be confidential. We need for all of us to get behind government's proposal, and I think we all desperately want to. They need to be much more transparent about their decision making. And at this stage, it just doesn't make sense, some of the things. As I said, we are fiercely critical, many of us, of the decision to send this AstraZeneca vaccine away. But this J&J pause is in some ways far worse, because the two vaccines which are immediately available to us, we're turning our noses up and we're pausing the one thing that is available to protect us. As I said, we haven't administered a single vaccine, where so many other countries in Africa actually started.
Professor Francois Venter, let's leave it there for tonight. He's the Executive Director of the Wits Reproductive Health and HIV Institute.